Now, studies have shown that healthy vision plays a huge part in the child's academic success.
So here with us today to offer parents tips and more to ensure that your kids have healthy eyes is Dr. Allison Jensen. Welcome.
Thank you.
Okay, so I want to dive right into this. You know, I'm so intrigued. Why is it important to catch vision problems early?
So great question. The reason is the visual system develops in early childhood. So if you have a problem, either an eye that's not seeing well or an eye that's crossing or drifting, if it's not corrected early, we really can't correct it in later childhood.
Oh.
So what are some things that parents should look for?
Good question. So sometimes it's really obvious, like a child will squint or move really close to something, or they might have a very common head turn or tilt that they always seem to adopt when they're looking at something. Also, if there's a family history of a direct relative who got glasses really early or had any kind of patching as a child or a lazy eye or drifting eye, those children really should see a pediatric ophthalmologist within the first few years because if we catch it earlier, the treatment plan is much easier and it can end up in much better vision in the long run.
Wow. So we always see the young kids with those adorable glasses. They're different colored and they're plastic. And what you're saying is that there's no time too early to go?
Absolutely. We see patients in the NICU before they're even released from the hospital. There's no too early, and early is definitely preferred, especially when there's a real medical issue. When we don't correct early, they can not develop vision normally.
Okay.
Yeah.
Okay, so tell us, kind of explain the difference between a pediatric vision screening and an actual comprehensive eye exam.
Sure. So a screening is developed to sort of flag asymmetry in the reflex of the eye, which can show one eye sees very differently, could see very differently than the other. And in today's world, there are devices that allow pediatricians to do that even at 18 months. They have photo screen devices. We no longer have to rely on the child to be old enough to read the chart, which of course is how we used to do it. So again, these bigger problems can be detected as early as 12 months by the pediatrician. And many times there are no signs to the family. So again, the family history is probably the most important thing, but if you have any inkling that either your grandmother or the parent or the doctor is thinking maybe they're seeing something, then just go ahead and have them seen by a pediatric ophthalmologist for a comprehensive exam where we can really figure out, do they need glasses, what they are specifically, if there's an eye muscle problem or any other medical problem.
So say that we're not seeing any differences in our children. Is it important to get the comprehensive screening as like a back to school type of thing?
Yeah, so it kind of depends. We always go back to family history. But if you just wore glasses as like an older child or a college person age, then those kids are screened, by the pediatrician right away. And then in kindergarten, first and second, that's a mandatory thing. And so we do want to check them periodically in that early childhood age. Just to make sure that they're not developing any problems. But when we have their basic exam, we can actually predict based on what they are at that moment whether they'll need glasses, and so that's also very helpful.
So is there an age, let's say that parents think that their kids have 20/20 vision, is there an age that they should definitely see you?
So unfortunately there aren't enough pediatric ophthalmologists or optometrists in the world to see every child.
Okay.
And that is why we screen, because we just don't have the manpower to do that. So between the multiple screenings children get, again, through their pediatricians and their early age, and every year at school until early elementary, and then I think they do it in 8th grade, it's if they have any signs or complaints, if they're squinting or holding something close, that would be a good time to do a comprehensive exam.
Okay. So tell us about eye safety. How can we keep our kids' eyes safe?
Great question, great question. Well, rec spec sports glasses are great. Some of the teams and sport require that. Other kids, parents just encourage it. We see a lot of eye injuries. I probably see one a week in my office, one significant eye injury a week from balls or hands or floors, or you wouldn't believe it. But trying to keep them by wearing the safety goggles is great.
Thank you so much.
Thank you,
You're
Dr.
welcome.
Jensen,
Thanks
for
for
sharing
having
all
me.
of that. Thank you. I appreciate you.